Hi everyone, am I audible and visible? Hi everybody, am I audible and visible? Okay, so welcome to this session on PSM NHPs. Okay, like I said, we will be studying about it. Alright, we will be doing national health program. So I hope everybody is healthy and happy. Good evening. Am I audible, guys? आपको भी मुबारक हो रमज़ान. Good evening everyone. Okay, so we have been following the schedule, I hope. Okay, so we have finished national health programs for the last week. Okay, so all NHPs would be discussed today, all the points regarding that. And today 5th and 8th of March, this coming week you will be doing environment as well as you will be doing biomedical waste segregation. Okay, so although we are not able to keep up with Wednesday and Saturday, but I'm trying to cover the roster, guys. So please have a look at the roster over here. Today you are doing this one. Okay, today you are doing all the NHPs. Next week we will be targeting on all the environment as well as water purification. Okay, can I begin now? Everybody give me a thumbs up. Can I start? Okay. Chalo, okay, so sorry for this little bit of setup issue. However, we should continue with the sessions. Okay, so let us begin. Thing is wrong actually with my screen setup. Okay, all right, chalo. So let's get on with the first question, guys. So today's national health programs. Let me see if you can answer this one, everybody. Let me see if you can answer this one. Okay, so anybody could try out this question. What is the answer to this question? I'll keep my photograph here. Yeah, like this, it's better. Okay, so in an urban area in state of Bihar, a primary gravita goes for institutional delivery on being motivated by an ASHA worker. What is the incentive she will receive under JSY? Anybody? What is the incentive she will receive under JSY? What is the incentive she will receive under JSY? So can you see that it's in a state of Bihar? So Bihar is a low performing state or a high performing state? My first question. So we all know that, guys, Bihar kya hai? Bihar in terms of delivery rate is a low performing state. Okay, Bihar is in terms of institutional delivery rate a low performing state. Okay, so now pregnant mother has gone low performing state. Okay, she resides in which area? Urban areas. So in urban areas it is how much for the pregnant lady? 1000. And for the ASHA workers in urban areas is how much, everybody? Whether it is low performing state or high performing state, it is 400. Okay, so let us quickly revise this incentives that you can see over here. It could come in your exam anytime. What I've taught you before also, that the incentive for ASHA worker, okay, is always going to be less than the pregnant females. Okay, than the pregnant females, and the incentive in rural area is going to be more than that in the urban area. So for ASHA worker, whether it's urban or low performing or high performing, rural, low performing, high performing, for rural areas ASHA is getting 600, for urban areas 400. From rural areas it's difficult to bring the pregnant females, so low performing state she's getting 1400, high performing state half of it 700, and in urban areas low performing state 1000 and high performing state 600. Clear, everybody? Will you remember this incentive, guys? This is very, very important. Give me a thumbs up if you are okay with this. Give me a thumbs up, everybody, if you all understand this. I hope I'm audible and visible today. Okay, chalo. So please don't remember this, don't forget this cash incentive. This is a very, very important question. Okay, moving to the next question. Which is not included in Ayushman Bharat under school health service? Okay, which is not included in Ayushman Bharat under school health services? What is your answer, guys? Albendazole prevention, health checkups, providing sanitary pads, IFA monthly, which is, these are all PYTs guys, so which is not included in Ayushman Bharat under school health services. वेरी गुड सी आर डी IFA मंथली थोड़ी ना होता है, IFA कैसे होता है स्कूल हेल्थ में, ओके. सो IFA इज गिवन वीकली, ओके. वन क्वेश्चन, फर्स्ट ऑफ ऑल, आयुष्मान भारत में स्कूल हेल्थ सर्विसेज इज अ पार्ट ऑफ इट. वी आर फोकसिंग ऑन albendazole prevention, we are albendazole prevention, okay, giving albendazole, okay. National deworming days, I hope you remember the national deworming days guys. When are the national deworming days? So national deworming days are on the 10th of Feb and 10th of August, okay. If you have to mark one, you will go for Feb. Health checkups, of course, providing sanitary pads, all right, to promote menstrual hygiene scheme. Is it clear everybody? So have a look at this guys, the services that are included in school health under Ayushman Bharat. Providing sanitary pads, ये important है. Screening for health conditions are part of services under Ayushman Bharat. Okay, most common school health reported infection reported among children is dental infections. Albendazole provided for deworming and IFA tablets are provided how? Weekly. Clear? Give me a thumbs up if all of you got this correct. Okay, not IFA is not given monthly, it is weekly. Okay, tell me the answer to this. Treat all strategy is an approach adopted by which national health program? Yes, anybody. Treat all strategy is an approach which has been adopted by which national health program? Did you have tea, coffee today? Yes. What is the answer? I've not got anyone answering so far. Treat all strategy, क्या होता है treat all strategy? Is an approach adopted by which? NTP, National TB Elimination Program, National AIDS Control Program, National Leprosy Eradication Program, या National Program for Prevention and Control of NCDs. Anybody? Please remember, treat all strategy is adopted by NACP. What is treat all strategy? Any HIV positive individual, okay, any HIV positive individual is started on ART, okay, is started on ART irrespective of CD4 count, okay, is started on ART irrespective of CD4 count. Please remember that, okay. Any HIV positive individual is started on ART irrespective of CD4 count. So treat all strategy is an initiative under National AIDS Control Program. Okay, all right. Chalo, moving to the next question. All are true for Ujjavala scheme except anybody. Prevention of child abuse implemented by Ministry of Women and Child Development. Prevention of child trafficking, all are true. What is your correct answer over here? Ujjavala scheme. Now see, so many times we have studied about Ujjavala scheme, है ना. तो Ujjavala scheme किसके लिए होता है guys? Ujjavala scheme, इसकी ministry क्या है? इसकी ministry of course Ministry of Women and Child Development है. So this is true. Okay, of course it prevents from child trafficking. This is also true. Is it preventing from child abuse? No, there is nothing like child abuse over here. It is child and women trafficking, okay. And in this we focus on rescue, rehabilitation and reintegration, okay. We have nothing to do with child abuse. That's not the correct word over here. It is for child trafficking. And you should also remember the ministry. See, Ministry of Women and Child Development is famous because it is the Ministry of ICDS, it is the Ministry of Poshan Abhiyan, it is the Ministry of Pradhan Mantri Matru Vandana Yojana, it is also looking after Ujjavala scheme. Clear? Everybody, something new that you've got, so that is how they can trick you with the question. Okay, moving to the next question. The following image is given is for Sapna Leprosy, Arohi for mental health, Meena UNICEF, none of the above. What is the answer? Very good. Please don't get confused. The one with the girl with the with the parrot behind her, she's flying. Why is she able to fly? Because all her child's rights are being protected, so she is happy. So that's how you can associate it. Okay, she's flying, her all her, she is like, there's no restriction as such, everything is good. So it is Meena UNICEF. Meena UNICEF is for child's right. Okay, now Sapna, we know Sapna is a mascot. Okay, she is Sapna mascot. Okay, she is actually a mascot which is being used under Sparsh initiative. Okay, Sparsh initiative to increase what? She's being used under Sparsh initiative to promote leprosy awareness. Okay, to promote leprosy awareness, guys. Okay, and see, she is actually a cured case of leprosy. Okay, she's actually a cured case of leprosy. And look over here, this is Arohi. Arohi is for what? Arohi is for, there's a Arohi Foundation in India. Arohi Foundation is for mental health. School bag for Sapna. Sapna के साथ दो चीज़ है, Sapna mascot under Sparsh initiative, school bag के साथ Sapna. ठीक है, everybody. Okay, chalo, let's have a look at some other MCQs. Okay, treatment duration for MDR TB. What are you going to mark now? What is the treatment duration now? Okay, so I haven't yet got the answer. Okay, now I think I'm getting the answer. Okay, treatment duration, come on. What is the new update, guys? Some of you are going with still option B. No, अब MDR TB का treatment duration क्या है? 6 months, right? Now MDR TB treatment duration is 6 months. This is an update. What is the regimen that we are giving? B, Paul, M regimen. Bedaquiline, Pretominate, okay. Linezolid, moxifloxacin. Okay, bedaquiline, Pretominate, linezolid, moxifloxacin. Am I clear? BPAL M is for MDR. It is also for rifampicin resistant. Okay, everybody, also we can try for pre-XDR. It is no longer 9 months. 9 months pehle tha the shorter oral bedaquiline regimen, 9 to 11 months, which was 9 to 11 months was 4 to 6 months of Chobzi, if you remember, 4 to 6 months of Chobzit and 5 months of Cozy. Okay, 5 months of Cozy. अगर आपको याद होगा, अभी कितना है? 6 months BPALM regimen. Clear? चलो, the lotus and the logo symbolizes. Every time we've done the logo, guys. Every time हमने इसकी logo बहुत बार पढ़ी है, right? We've studied the logo a couple of times, everybody. But can you tell me the logo over here symbolizes what? The logo over here symbolizes what? The lotus in the logo basically symbolizes what? What is the answer over here? See, this is the logo of what? This is the logo of National Leprosy Eradication Program. Okay, this is the logo of National Leprosy Eradication Program. Now, if you see this over here, the lotus is the patient. Okay, how many of you got this correct? So I got mixed answers. A, B, C सब लिख रहे हैं. Lotus is the patient. ठीक है, hand जो दिख रहा है आपको, ये hand. Okay, this is the program. Okay, this is the program, and the sun's rays that you can see over here is MDT. Clear, everybody? How many of you got this correct? Very good, guys. Okay, so yeah, very good. So that is very, very important. You should always remember the symbol of this leprosy ka logo. And what is the name of the program? National Leprosy Eradication Program. What is the status of leprosy in India? So we all know leprosy has been eliminated from India. Okay, eliminated from India. And we also have an elimination criteria, which less than 1 case, prevalence should be less than 1 case per 10,000 population, and the current prevalence of leprosy is how much? 0.45. Okay, current prevalence is 0.45. Clear? Everybody, will you remember this logo? What it stands for? Chalo. Simple PYQ hai, so I thought I will ask you what is JSSK. Quickly tell me. Yeah, what is the answer to this? What does JSSK stand for? Janini? Janini what? Very good. किसी ने गलत तो नहीं किया इसको? जननी शिशु सुरक्षा कार्यक्रम, जननी शिशु सुरक्षा कार्यक्रम. Very good. JSSK stands for what? जननी शिशु सुरक्षा कार्यक्रम. All right. शिशु सुरक्षा कार्यक्रम का क्या था emphasis? Can you just give me one moment, guys? Okay, Janani Sishu Suraksha Karyakram. All right. So now tell me, if you talk about Janani Sishu Suraksha Karyakram, everybody, what are the two most important things? This is Janani Sishu Suraksha Karyakram. The buzzword is free, plus it includes what? Sick infants. Free everything. Okay. Free drugs. ठीक है. Free drugs. Free just a second. Just a second. So sorry guys, just a second. Okay, कहाँ थी मैं? So sorry for that. Yes. So what is this, everybody? This is free plus sick infants. What was happening under Janani Sishu Suraksha Karyakram? Everything was being given free. Free drugs, free diet, free diagnostics, free vaginal delivery, free C-section. And for the first time, we were also including children up to 1 year. Is it clear? So that was Janani Sishu Suraksha Karyakram. Now can anyone tell me, the following image is a component of which national health program? Anybody in the class can tell me what is the answer to this? Let me see your answers. Chalo, what is the answer to this? What is the answer to this? Anybody? Okay, so the following image is a component of which national health program, everybody? Very good. The answer is NTP, National TB Elimination Program. What is this box? This is a MERM box, Medicine Event Reminder Modulator box. Okay, so this is a medicine event reminder box. Okay, so what happens in National TB Elimination Program? This is used in that. Okay, National TB Elimination Program. Okay, National TB Elimination Program. It's used in that. See, read this. MERM box is a sophisticated device which is designed to support TB patients in managing the medication schedules effectively with its real-time tracking. Okay, what are we using? We are using real-time tracking. This is what? This is NICSHE. NICSHE क्या है? Software for TB patients. Notification of TB patients. This is what? DOTS 99. Clear? So MERM box is an initiative under National TB Elimination Program. Okay, anybody? Which antilarval is preferred under integrated vector control management? Which is better one? Preferred or which is better? Can you tell me? Is it Paris green? Is it Fenthion? Is it pyrethroids? Is it abate? What is the answer here? Abate is better, guys. Abate is better, not Paris green. Okay, Paris green से better क्या है? Abate. Okay, Abate is better. Please remember, Paris green से better है Abate. Okay, Abate is the one which is used. It's also used in less amount. Okay, so the anti-larval which is here is this. Pyrethroids, Fenthion, they are more of anti-adulticides. Okay, more than Paris green, we prefer what? To use Abate. Okay, it is used in lesser quantity also. Is it clear, Ravi? ठीक है? Chalo, so this was integrated vector control measures. So we were talking about the chemical control where we can use Paris green Abate, but Abate is better, which is being promoted under the integrated vector management program because we use it also in lesser amount. Okay, all right, let's go to the next question. Simple, what is the definition of visual impairment under NPCVBI? What is the answer to this? Okay, let's see what you're answering. Very good. I have not asked. Please read the question carefully. Carefully. कोई सही आंसर नहीं लिख रहा है. कोई भी. मैंने क्या पूछा है? I have asked the definition of visual impairment. What is happening? Most of you have gone and written about blindness. ऐसे ही हम लोग गड़बड़ करते हैं एग्जाम में. विजुअल इम्पेयरमेंट पूछा है ना मैंने, ब्लाइंडनेस तो पूछा ही नहीं है गाइस. ब्लाइंडनेस होता है लेस देन 3/60. विजुअल इम्पेयरमेंट कितना होता है? विजुअल इम्पेयरमेंट इज 6/18, लेस देन 6/18 इन बेटर आई. In better eye with available correction. In better eye with what? With available correction. Visual impairment is less than 6/18. Blindness is less than 3/60. So what happened over here? देखो 8 marks ऐसे ही हम लोग नहीं, like we can't let it go, no, just because we were in a rush and we ended up marking the definition of blindness. Did you understand? Instead of visual impairment, everybody? चलो. Let's see the next one. Read this and answer. Rakhi. Okay, what is the answer to this? Under Anemia Mukt Bharat program that aims to address anemia across India through targeted interventions, which statement describes iron folic acid supplementation? So IFA is administered solely during pregnancy and lactation. IFA is administered solely during, no, under Anemia Mukt Bharat it is given to 6 beneficiaries. I hope you remember that. ठीक है? 100-day course? No. Yes, very good. 180 days before and 180 days after. Okay. Administering IFA during first trimester is adequate? No. When under Anemia Mukt Bharat, when do you start giving IFA, guys? It is provided during the second trimester of pregnancy and continues during lactation for up to 6 months. Guys, what is the purpose of iron folic acid administration under Anemia Mukt Bharat? It is not, please don't say to prevent neural tube defects. No, it is to prevent what? To prevent megaloblastic anemia. Okay, what is the purpose? To prevent megaloblastic anemia. Got it, everybody? What is the purpose? The purpose is to prevent megaloblastic anemia. Chalo, good. Let's go to the next one. Quickly, let's have a look. Which of the following is not a component of RCH program? Safe motherhood, diarrheal disease control, screening and treatment of STD, women education and empowerment. What is your answer over here? Okay. किसी का आंसर क्यों नहीं आ रहा है? डी क्या है? बी सी सारे लिख दिए. बी क्या है ऐसा? Guys, think a little. See, RCH is reproductive and child health, and under child health we have one of the very important initiatives, guys. What is that initiatives? IMNCI में तो न्यूमोनिया डायरिया सब पे कंट्रोल किया जा रहा है, तो डायरिया तो है ही. RCH में motherhood, diarrhea, of course, screening and treatment of STD, of course, that is a part. Reproductive, ठीक है, child health, so maternal, child health, reproductive, family planning, everybody. Is it clear? So what is the answer over here? Women education and empowerment. That is not the answer. Oh, wow, so nice, Deepthi. Great radiology resident, very nice. I'm sure you could be inspiration to everyone attending the class. Hope you're doing good. Thank you for messaging to me. Thank you so much. God bless you. Chalo. ओके सो कितने सारे लोगों ने इस पे कुछ अलग आंसर लिखा. गाइस आरसीएच प्रोग्राम में ये सब आता है. देखो क्या क्या आता है आरसीएच प्रोग्राम में. एज यू कैन सी असेंशियल ऑप्स केयर, इमरजेंसी ऑप्स केयर, 24 आवर डिलीवरी, एमटीपी, कंट्रोल ऑफ आरटीआई एसटीआई, ओके, immunization, newborn care, diarrhea control, vitamin A deficiency, prevention and control of anemia, training of dice. Will you remember this? Of course I do. Okay. Chalo, let's have a look at the other question, guys. Which group is not included under TIs, which are specific group of intervention directed towards high risk group under National AIDS Control Program? What is the answer? Okay, you were meant to write. Used to pester you with multiple questions, huh, Deepti? हाँ अभी मुझे ये इतना डाल दिया. ओके चलो गुड गुड. ओके सो व्हाट इज द आंसर? No, I can also trouble you with questions sometimes, okay? All right. Face to face classes में I can definitely trouble you with questions. And अभी it's like obviously I can't, you're not near me, so there are a couple of things that I can't really ask you, or there are certain things that we can't really talk about, okay? But then it's always fun when we are face to face. We can interact more, है ना? But this is also better. This is also good that we are, able to solve questions together. I always try कि week में once I should definitely come online and take classes. Although the days थोड़ा सा ऊपर नीचे हो जाता है, but I am sure that you can bear with me for that. Yes? चलो. So what is the answer to this? ये क्या हो रहा है? सबका mix answers आ रहा है. B भी आ रहा है, D भी आ रहा है. बच्चे, which of the following is not us, like, see, what are TIs? Directed towards high risk group or the other populations, okay? Now here, which is not a TI, which is not very high, doctors and nursing professionals, they suffer from accidental needle prick, guys. They are not high risks, or they are not even bridge population. High risk क्या होते हैं? They suffer from accidental needle pricks. High risk क्या होते हैं? High risk होते हैं if you talk about the high risk groups, okay, high risk groups क्या है? Commercial sex workers, men having sex with men, injectable drug users, okay, transgenders. What are the bridge population? Male migrants, single male migrants, okay, truck drivers. Now of course our street children are also at risk because they indulge in unsafe practices. Are you understanding? Doctors and nursing professionals suffer from accidental injuries. ठीक है? So a couple of you got this correct. Please pay good attention to this. जैसे give me an example of a TI providing female condoms to commercial sex workers. Injectable drug users में opioid substitution therapy. ठीक है Ravi? Street children can indulge in high risk behaviors. Okay, they are wandering here and there. Have you seen them on the streets? So there are chances of them indulging in high risk behaviors. Doctors and nursing professionals तो सिर्फ needle prick injury होता है, ठीक है? वो भी कैसे? Accidental. चलो, what is the answer to this? Okay, I'll try nurse's diary to take for NEETPG exam. If I'm not able to, please check out the Prep Ladder YouTube channel. I had just taken a YouTube image based session. You can just type my name and write images. Just a couple of months back, okay, where we have more than 100 images. Those are equally useful for NEETPG also. ठीक है? So what is the answer over here? Very good. CVD, cancer, diabetes, stroke. This is for health in your hands. Now it is National Program for Prevention and Control of NCDs. Okay. And in this, what are the newer inclusions? CKD, COPD, rheumatic heart disease. Okay. Non-alcoholic fatty liver. Non-alcoholic fatty liver. Okay, there's one more. Non-alcoholic fatty liver. There's one more. Non-ST elevation, MI. Ayush modalities, all are the newer inclusions. So what has the program's name changed to? National Program for Prevention and Control of NCDs. Okay, chalo. Let's see a couple of more. Which organization is involved in intersectoral coordination in the ICDS? Anybody? I'm trying, there's something happening today. Is this okay? I'll have to get the screen checked. Actually कुछ गड़बड़ है, YouTube के setting में नहीं बैठ रहा है. I'll get it done next time. Kirtana, can you just manage for today, dear? I'm so sorry for it. I'll try to get it done next time, okay? What is it? Very good. ICDS, NHM. What is the current name of NHM? So it is nothing but Pradhan Mantri. The name has updated. Samagra स्वास्थ्य मिशन. ओके, प्रधानमंत्री समग्र स्वास्थ्य मिशन. ठीक है. Okay, next one. What is the answer to this? Which of the following indicator would be used to evaluate the effectiveness of malaria surveillance? All right, wait. Let me try to keep it this way if it suits you all. Guys, एक सेकेंड रुको, मैं एक चीज़ कर रही हूँ. ऐसे चलेगा? ओहो ओहो. All right, now is it okay, everybody? Okay, what is the answer to this? Which of the following indicator would be used to evaluate the effectiveness of malaria surveillance? Okay, effectiveness of surveillance. So what is your answer over here? Annual parasite incidence और annual operational efficiency of the program. पहले तो मुझे ये बताओ, API annual parasite incidence or index is a measure of burden, guys, and elimination strategies are based on it. Okay, elimination strategies इस पे based होते हैं. ठीक है, elimination strategies. ABER is for operational efficiency of program. मैं यहाँ क्या बोल रही हूँ आपको? I am asking you malaria surveillance. So when I have to look for this surveillance, everybody, I have to look for an IPR is index of sensitive index of recent transmission of malaria. तो अगर मुझे surveillance देखना है, so it is about preparing malarial slides. Right? It is about preparing malarial slides. So what will you do? What is slide positivity rate? Out of the slides examined, how many are positive? So slide positivity rate तुम्हारा क्या होता है? If you talk about slide positivity rate, everybody, it is used during burden of malaria. So if I talk to you that, just give me 1 second. Yeah. All right. So what have you answered over here? ठीक है. So most of you B, C में आप doubt कर रहे हो. Whenever you have to talk about surveillance, it means how many slides we have prepared. Okay, how many slides we have examined out of the total population under surveillance. How many slides we have examined? Clear? So more appropriate would be B over here. Is it clear? ठीक है. चलो, going to the next one. Biological method for mosquito larva control is done by. What is the answer over here if I ask biological method for mosquito larva control? क्या है इसका आंसर guys? Biological method for mosquito larva control. इसका आंसर क्या है? Biological. So integrated vector control measures, ECB, environmental, chemical, biological. Very good. So instead of asking you Gambusia fish के बारे में सीधा ईट्स एडीज. ओके, द लार्वा. आई एम जस्ट आस्किंग यू बायोलॉजिकल बिकॉज आई होप यू रिमेंबर एंटी लार्वल मेजर्स में क्या है, ECB, एनवायरमेंटल, केमिकल एंड बायोलॉजिकल. सो बायोलॉजिकल में क्या हो गया, गैम्बूसिया फिश. ठीक है, alright. So this I've just mentioned about Gambusia. You can find out, read about it later also. Okay, ponds, ditches में इसको use करते हैं. चलो, what is the frequency of conducting checkups for children aged 9 to 18 years under राष्ट्र बाल स्वास्थ्य कार्यक्रम? Anybody? Frequency of, what is the frequency of conducting checkups for children aged 9 to 18 years under राष्ट्र बाल स्वास्थ्य कार्यक्रम? So quickly guys, we have 5-6 minutes on the clock. What is your answer to this? राष्ट्र बाल स्वास्थ्य कार्यक्रम में frequency very good. Once every 6 months. Good. This we all know, right? So you can just read this later also. See, Rashtra Bal Swasth Karyakram was launched in 2018. It is based on providing screening and intervention services to 0 to 18 years. Okay? So newborns will be screened for birth defects at the time of delivery itself. Okay, children between 6 weeks to 6 years will be screened at Anganwadi centers by mobile health teams, and children between 6 to 18 years are schooled at government schools by mobile health teams at least 2 times a year. So it is every 6 months. So that means bi-annually. Is it clear? Everybody इसको ध्यान रखना कि स्क्रीनिंग कब कब 0 to 18 years की हो रही है. चलो, quickly tell me the answer to this. A 11-year-old school-going girl came for a health checkup. Hemoglobin 10 है. Which of the following government programs would be beneficial for her? What is your answer over here? Hemoglobin उसका 10 है. कौन सा government program इसके लिए beneficial रहेगा? JSY. JSY is for promoting institutional deliveries. नवजात शिशु सुरक्षा कार्यक्रम is to provide resuscitation services. Okay, newborn care. प्रधानमंत्री मातृ वंदना योजना, कैश इंसेंटिव ऑफ ₹5,000. राष्ट्र बाल स्वास्थ्य कार्यक्रम. वेरी गुड. ओके, ऑलराइट. व्हाट इज द आंसर टू दिस? स्कूल हेल्थ प्रोग्राम इज अंडर, इट इज द रिस्पॉन्सिबिलिटी ऑफ सब सेंटर, PHC, CHC, डिस्ट्रिक्ट हॉस्पिटल. स्कूल हेल्थ किसका रिस्पॉन्सिबिलिटी है गाइज? गुड. PHCs. Okay, school health is a responsibility of PHC. Medical officer should go perform school health checkups once every 6 months. Great guys. Chalo, what is the answer to this? Which of the following steps is not included under steps approach of WHO? तो steps approach of WHO में कौन सा step नहीं है? Therapeutic assessment, physical assessment, psychological assessment, behavioral assessment. Who's going to give me the answer to this? Good. Lokendra has come up with the answer very beginning. बच्चे steps approach, surveillance of risk factors for NCD. है ना? So we never talk about therapeutic approach over here. Are we talking about therapeutic approach? No, psychological है guys, psychological है. Only a few of you gave this correct. ये देखो, steps is a surveillance tool to find out about the risk factor. First step में आप questionnaire भराओगे, ठीक है? आप क्या भराओगे? क्वेश्चनेयर भराओगे, एंड यू विल टेक इन्फॉर्मेशन ऑन लाइफस्टाइल, बिहेवियरल, साइकोलॉजिकल फैक्टर्स. स्टेप 2 में फिजिकल मेजरमेंट्स, एंथ्रोपोमेट्री. स्टेप 3 में आप क्या करोगे? लैब. कहीं पे आई मीन स्टेप 1 विल गेट अ क्वेश्चनेयर फिल, स्टेप 2 विल टेक फिजिकल मेजरमेंट्स, स्टेप 3 इज लैब. नोवेयर आर वी टॉकिंग अबाउट थेरेप्यूटिक असेसमेंट. आर यू अंडरस्टैंडिंग? एवरीबडी गिव मी अ थम्स अप इफ यू गॉट दिस. छोटी छोटी चीज़ों में आज गलतियाँ हो रही हैं. व्हाई आर वी मेकिंग मिस्टेक इन दीज little things guys? Okay, which disease is targeted under NVBDCP with the following vector as shown in the image? Which vector is this? What? INIPI, hip. Okay, what is this guys? Which vector is this? पहले इसका नाम बताओ. If you, what is it? Short body, long legs. Short body, long legs. This is a Q-legs. And if you rotate it, hunchback without white stripes on a black body. So this is what everybody? This is J. Rift Valley, Rift Valley, valley में farming ADs. Malayan Mansonia. Okay, visceral leishmaniasis, काला असर. ठीक है? This is J. Okay, so I hope everybody got it correct. Good. Okay, one more question I'm going to give you based on two more questions for the day. Based on Globocon data, which cancer type is the most prevalent among males in India? Today I framed a different type of questions, although these are PYTs guys. So I've tried to put them in a different manner, ask them all. मतलब आज हम लोग सिर्फ बेसिक्स को टेस्ट कर रहे हैं, ठीक है. तो एक ये क्वेश्चन बताओ, मेल्स में सबसे कॉमन कैंसर कौन सा होता है? विच इज द मोस्ट कॉमन कैंसर अमंग मेल्स इन इंडिया अकॉर्डिंग टू ग्लोबोकॉन डेटा? Only one, a couple of you are only marking it correctly. Guys, prostate cancer most common नहीं है. Globocon, it is lip and oral cavity. National Cancer Registry, it is lung. If somebody asks you most common cancer in India and world, okay, what is it guys? It is breast cancer. Okay, Globocon के according males में it is lip and oral cavity. Clear? Females में it is lung cancer. ठीक है. ओके, फीमेल्स इन इंडिया, इन रूरल इंडिया सबसे कॉमन कैंसर क्या है? रूरल इंडिया इट इज सर्वाइकल कैंसर, ठीक है. रूरल इंडिया इट इज सर्वाइकल कैंसर. चलो, ओके, मूविंग टू द लास्ट क्वेश्चन फॉर द डे. कैन यू टेल मी द आंसर टू दिस? As per INICET guidelines, a diagnosis of pneumonia is made in a 6-month-old infant when child exhibits rapid breathing with a respiratory rate exceeding. What is it under INICET? What is the answer to this, guys? $60, $50, $40. Up to 2 months respiratory rate कितना है guys? Beyond 60 per minute. Okay, all right. फिर 2 to 12 months कितना है everybody? Respiratory rate beyond 50. Okay, 1 to 5 years कितना है guys? Respiratory rate beyond 40. So here I gave you how much? 6 months. तो किस में बैठेगा? इसमें बैठेगा. So more than 50. Good everybody. Okay. So a short class today, but I hope you enjoyed the questions today. Give me a thumbs up guys. Next class will be conducted pretty soon. I will let you know the date guys. Per week we will try to do 1 class, if possible 2 class everybody. I am mostly trying it for Sunday. Okay, I will try for Sundays at least. Okay, but जैसे अभी Sunday नहीं हो पाया, so the NHPs I took today guys. Keep revising.